Hi, good morning everyone. I'm Nancy Kimmel with Phlebotomy Career Training Info Shorts, and today we're looking at online medical education. And so um, we're just going to take a look at how the online arena with respect to education has grown exponentially over the past 50, 60 years. I don't believe there's a university anywhere in the United States, I would venture to say, that doesn't have some type of online program that students can take advantage of. I think it's interesting for students that are looking to expand their horizons, especially in the medical field, because the medical field does require a significant amount of hands-on practice and patient interaction, and that is something in the medical field that can never be, I think, separated. But the didactic portions can absolutely be taught online. I think the great thing about online is that there's advanced 3D models for virtual dissection. There's access to instructors from all over the world. There's a cornucopia of knowledge that is at the student's fingertips 24/7, 7 days a week. It's really quite remarkable, and I think that with all of this access, it may be a little overwhelming to students that prefer perhaps or are used to the traditional methods of studying, where you come to class, the teacher gives you an assignment, you listen to a lecture, you have to go home, do the assignment, bring it back 2 days later. If you're late, you fail, you get a bad grade. These are, a lot of students are trained to think this is the way of education, and it's not. The adult learner cannot be pigeonholed into the same peg as, say, a high school student. Even they are taking online classes now and are quite savvy at it. The online student looks for, the freedom of study. They want to direct their own path, and by all means, their path is theirs to direct. The work you put in is the work that you get out, is the success that you get out. Your success is measured by how much work you put in. It's kind of like physics and kinetic energy. So I think, when it comes to online and people are, ruminating on whether that's for them or not, I think it's important to take into consideration what do you have in your area, and whether or not the course that you're taking is going to require a clinical, because clinicals are required. A student cannot graduate, especially from a program in the medical field that requires patient care. You have to have the hands-on training. You have to have the hands-on experience with patients. So while on one hand, online can create an isolation, a type of isolated feeling, on the other hand, it opens up many collaborative opportunities, and I think the student's personality has a lot to do with whether or not they choose to take advantage of that. Also, online comes with its own set of technical problems, obviously, which most of the time can be easily circumvented. However, I think we've really come to a time in this particular century where online learning is kind of the norm now, and I think more and more students need to open up their mind and have a kind of a different mindset on how they look at learning, because I believe traditional learning, while it has its place, is going to become, I think, more of a anomaly maybe at one point in the future. So good luck on your journey. I hope diligence, and I hope your path is smooth, and thank you for watching Phlebotomy Info Shorts today.